National Demographic and Health Survey of 2018, we have the prevalence of stunting in Kwara State to be like 32%. For the acute malnutrition, we have the prevalence at 7.8. The chronic malnutrition, the stunting rate, was actually more alarming because over the years, severe acute malnutrition, if left untreated amongst children, leads to their death. But chronic malnutrition, the affected children do not die, but they end up not doing well in life because they've suffered injury to the brain in terms of brain development. At the end of the day, they end up being dependent people socioeconomically. And that's the reason why chronic malnutrition, that is stunting, is linked to human capital development and generally economic development of a country. So currently Nigeria is losing about 11% of GDP due to stunted children. So that necessitated the World Bank together with the federal government and some state government to try to come together to address this problem.
Nutrition financing is an integral part of health financing the world over because there's nothing you're doing in health that does not tie directly or indirectly to nutrition. The ANRIN project is a World Bank assisted project. It's funded by the World Bank. It's accelerating nutrition results in Nigeria. It has assisted the Kwara State's Ministry of Health and the Kwara State government to improve nutrition outcomes, particularly in pregnant and lactating mothers and children between the ages of 0 to 5. It supports our previous and continuing activities in the Ministry of Health, Ministry of Planning, and a host of other allied MDAs towards improving the nutritional status of the residents of Kwara State. His Excellency Madam Abdurrahman Abdurrazak, CON, has demonstrated continuous and wide and deep commitment to nutrition as a key component of health. His Excellency's administration met a backlog of outstanding counterpart funding that was not paid, particularly with reference to the ANRIN project. Upon assumption of office, he paid the backlog for 2018 and 2019. That's to the tune of 50 million per year. So he immediately cleared 100 million naira in backlogs and went ahead to provide another several millions in counterpart funding for this singular project alone.
In the course of the following year, we paid periodically for 2020, 2021, and ensured that well over 200 million has been injected as part of the state funding into the program.
To this end, the ANRIN project and the state's counterpart funding has gone a long way to provide dedicated, targeted financing to resolve nutrition challenges in Kwara State.
Ẹ káàárọ̀. Àwa òṣìṣẹ́ ANRIN ni. Àwa láti Solina Health lórí program kan tá ń pè ní ANRIN. So a fẹ́ fún àwọn ọmọ yín ní Ugadi.
Going by the high prevalence of chronic malnutrition in our land, particularly in Kwara State, and with the opportunity that ANRIN project presents, we were very intentional in our strategies to ensure that we reach the underserved, particularly the malnourished children, the pregnant and the lactating mothers, with the care from the ANRIN project. So we're having a two-pronged intervention in the communities to serve the underserved areas, and we have an health facility-based intervention that was managed exclusively by our healthcare workers. So for the community component, we were very strategic in the contract management procedures to ensure that we have highly qualified, highly skilled non-state actors that was working, complementing the effort of government to reach the community and the underserved areas.
Yes, ma'am.
And we have Solina Health, and we also have the P&P, ProMed and ProMed. So those are the two non-state actors under which the whole states have been divided into two. A group taking care of, each of the groups taking care of 8 local governments each. And there, they have programs where they move from house to house, identify eligible children into the intervention, and mothers as well.
And that has been very successful in the sense that there are so many barrier access to these vulnerable groups reaching out to the facility. So most of them, like the hatchback phenomenon, most of them are outside in the community, either due to financial reasons, accessible roads and all the likes, you know, or cultural beliefs, you know. But the community approach helps us, number one, you know, to improve access to these people, because the people that are the volunteers are recruited from the community. They know their community, they're familiar with their terrain, so they can kind of embrace them when they go around. Number two, they don't need to go to the facility. You don't need to spend any money on transport. You don't need to stress yourself. So it increased the acceptability and utilization of these nutrition services. So that's the peculiar thing about the ANRIN project.
In Kwara State, we have 16 LGs, out of which Solina Health is implementing in 8 LGs. For pregnant women, we provide them MRICN. MRICN is maternal, infant, and young child nutrition counseling, which is more like health education. We advise the pregnant women, once they are pregnant, to register an antenatal. Secondly, to also eat food called balanced diet in terms of carbohydrate, nutrition, vitamins, and then all of those food that will be healthy for the mother and the baby. That even those meals that those pregnant women take does not contain all the components of the meals. So that's why what the ANRIN program is supplementing.
IFA supplement ni fún olóyún, gbogbo nǹkan tó yẹ kẹ́ máa jẹ tẹ́ rí jẹ nígbà tó yẹ kẹ́ jẹ tẹ́ bá ti ń lògùn ẹyọ kan lójúmọ́ lẹ máa lò.
One of the supplements to pregnant women is IFA, iron folic acid. It's actually to build their immune system and also to ensure that they have sufficient blood towards safe delivery. We also know malaria can be very damaging for pregnant women and the unborn baby. For instance, it causes stillbirth, brain damage, and the rest of them. I also impair the vision of the unborn child, especially chronic malaria. Towards addressing this, we provide an IPTP. IPTP is intermittent preventive of malaria in pregnancy. For IFA, immediately we discover that they are pregnant, we give them 30 tablets per month, and so they take one every day. And we advise them to take sufficient water in order for the IFA to actually, you know, work very well. And so they are supposed to take 90 doses for the duration of their pregnancy. So whether the child is successfully given birth to, from 6 months old, that child is qualified for 3, you know, drugs or commodity that we distribute. One is vitamin A blue, where the child will be placed on, is to improve the vision of the child and also provide all of those nutrients that is not completely available in the food that that child is taking. You recall we advised the mother to place the child on exclusive breastfeeding for the first 6 months. But whatever the mother eats, that is what the child also is getting directly through the breast milk. So all of those commodities or nutrients might be missing in the mother, and then we supplement with what the ANRIN is supporting. Another thing is that once that child is 6 months old, it's also entitled to micronutrient powder. Micronutrient powder is also to improve the immunity of the child and also to develop the brain child.
Lukewarm. Oye ke wá sọ ẹ̀kọ́ lórí iná kó máa hó báyìí kẹ́ dá sí ó máa dúdú ni o tẹ́ wá ní antivirus wá fún wa poison gbogbo oúnjẹ ló dúdú oúnjẹ. And
then lastly, we'll give the child zinc ORS in case of any diarrhea or vomiting while the child is growing up. It's actually on the need basis. We give them to keep. When the child shows its symptoms, then they can actually use zinc and ORS to as a first aid, you know, intervention. If the child responds with 5 not, we ask them to actually go to the facility for further medical attention.
If you look at the report of the NDHS, that's the National Demographic Health Survey, and you disaggregate it into urban and rural outcome. So majority of this indicator is as a result of the output of what is happening at the rural settlement. So which now affect the total country result. So we need to find a way to meet those people that are staying in very core rural area so that we can present a better outcome for our nation. And also in visiting them, we are also mindful of their culture. So when they see that you respect their culture, then they welcome you. So we also look out for the major stakeholders in the community. Those are the people they listen to. So when we meet the people they listen to, and we're able to make them buy into the idea of our health project, it is the person that will now speak for you. So that way it will make your work very easy and they will accept whatever you are bringing.
Onnani hadaro on daron shede sosai be onon be suko daro on nyamu sosai nyamu haito on kadi daron ko dashi nyamu kambe me ani daron shede.
This program has even helped us in a lot of ways to bridge the gap between the rich and the poor. Even these planning men, they don't understand that there is an essential importance of drugs on them when they are pregnant. They believe in taking apps and other stuff like that. But with the help of this program, we'll be able to reach out to them and be able to counsel them, proper counseling, I mean, and they were able to be convinced. They will even call you. Our wives are pregnant, our adolescents are pregnant, come and give them drugs. Because when they give birth, when you see their child, you like, as this child for them or for the American people, because of their skins, the way they behave, they've been able to change their mentality about healthcare services.
And in the areas of our facilities, we ensure that we have proper monitoring, mentoring, and on-the-job training and supervision of our healthcare workers so that they can deliver on this intervention.
Presently, we have 145 facilities spread over 16 LGAs. It's where we have trained healthcare workers on how to provide these services.
Not only that, we ensure that our supply, all the commodities that we need, vitamin A, zinc, ORS, micronutrient powder, are in good supply.
This drug is being distributed to all the supported health facilities in which these drugs are being given to the pregnant mother freely without collecting any money from them. And also, it has increased the patronage of all these ANRIN supported health facilities because of the free interventions given to them. Also, there is food demonstration being carried out for the nursing mothers and the pregnant mothers too on what type of food they're supposed to be taking during pregnancy and to the children for complementary feeding after 6 months of exclusive breastfeeding.
And the drug is working faster. Before, we used to refer a lot of patients to secondary level due to anemia, due to postpartum hemorrhage. But now, a lot of our patients are not suffering from anemia because they are using the drugs regularly and they are delivered safely, no postpartum hemorrhage so far.
By the time they come back to check my PCV, I even ask myself, is it okay? Okay. So I think the blood tonic and everything they are giving me then really helps.
Coming for the first antenatal, when the lab test was done, I said I have low PCV. So by the time I was given the ANRIN drugs, I started using like the folic acid, the ferrous, and the anti-malaria drugs. I was able to feel comfortable. Then my PVC also increased.
We have moved from 1,500 from 2021 to about 570 in 2023. That's about like 300% drop in the number of pregnant women reported with severe anemia in our facilities. That is the data that we have presently. But if you look at the feedback that we are getting even from the field, we believe that we have also been able to reduce the cases of malaria in pregnancy in these facilities.
When I gave birth, my baby was 3.1 kilogram. After like a week or 2 weeks that we went to the hospital, she also weighed 3.5. So after breastfeeding, which is exclusive breastfeeding, after 6 months, I'm able to start using the supplement for her. And after that, we went to the hospital and she weighed 4 points. That means the supplement is okay too.
Nata to imagine kí oyún mi tó bí 6-7 months kí n tó bẹ̀rẹ̀. Mo máa wá feel jàìn-jàìn. Jọ̀njọ̀ kí n jẹ́ kí n gbádùn rárá. Jàìn-jàìn. So bí mo ṣe wá ní èmi dẹ̀ ní mo máa ń sá fógùn mọ́mì. Wọ́n máa lé mi kí tó lóògùn ni. But mo wá lo ferrous yẹn bí 2-3 days interval. Mo rí pé mò ń sùn, ọwọ́ mi ò kú, ẹsẹ̀ mi ò kú. Láti ìgbà yẹn mò ń lò dáadáa, especially that ferrous and folic acid.
And then we look for opportunities to also make these interventions available in these communities. We leverage on programs like the MNCH Week, the Maternal Newborn Child Health Week. We also leverage on the World Breastfeeding Week to ensure that we get our message and our interventions across to those that really need it, especially in hard-to-reach areas.
In addition, we also have opportunities to interface with the public on a general basis by way of sending out jingles on nutritional information about breast milk, about the nature of feed to also put into the children's life after being weaned off breast milk. The importance of hospital visits to address various challenges in health that can also mitigate the effect of good feeding, and it makes such efforts wasted. So some of this information gets to members of the public through the ANRIN program. So for those who miss it in terms of one-on-one contact at home, those who miss it in terms of coming into the hospital, those who also miss it in terms of listening to radio or television messages, they're able to see for themselves. In fact, as far as also branding the keke napeps across some of the various junctions, or what do we call this, the bus stop, where people take bikes or take relevant kind of transport means to get to their workplace. So the hospitals were also targeted for those display, market centers were targeted and so on. So those are the few things I know we've done, and the impact has been tremendous. We've been able to see some change in understanding, change in orientation. Yes, the information is getting to the public.
And we've seen anecdotally, we've seen results directly on the fields. We've spoken to people, beneficiaries, team members all across Kwara State, and these impacts, these attempts are working. Our efforts are yielding results. To this end, the figure we are expecting for our nutrition figures compared to what it was in 2018 will be considerably better. We look forward to the report.
Scientifically, when you talk of impact, it has to be evidence-based in terms of data. There's a current NDHS, ongoing, which we expect will speak to the data itself. Though ANRIN, the project has a mobile and web-based application that the community volunteers use to provide services. So based on the feedback, the data we have from that app, we can say categorically that ANRIN has been of significant impact in terms of the coverage, the number of beneficiaries, the follow-up and things like that. We can say, but by the time the NDHS, the latest NDHS comes out, then we'll be able to compare with the baseline we have from 2018 and then know. But definitely there will be tremendous improvement.
Community volunteers reported that in one of the communities they went to, they've never seen vitamin A bread before, and they were so happy that we brought this vitamin A bread, and some of their children have vision challenges, By the time they take this vitamin A in particular, they picked up and the vision became better. In fact, they now say, okay, please go and bring us more of this vitamin A red. So those are the success stories that ANRIN has actually contributed to, following the challenges we witness in the community and how we're able to respond to these challenges and to see how within the limit of the project we address them.
Kò yá mọ́. Torí ó yà sí, ó wá wẹ́rẹ́rẹ́rẹ́ báyìí. Kódà tó bá jókòó tó bá sùn yóò yà. Tó bá sùn lásán yóò yà tí ó yàgbẹ́ tí ó yà nǹkankan yóò kàn yà rẹ̀. Kò yà ràn yẹn mọ́. Ikùn ẹ̀ ti lọlẹ̀.
Over the years, we've learned some things. That is to say that nutrition is not something to be relegated to the background. And independent of this project, the state government has been strengthening the nutrition program in Kwara State. So while we are using and benefiting from the support that ANRIN is providing for us, that program is maturing enough now to be able to step in at the expiration of the 5 years of the ANRIN project and continue to deliver similar, if not even bigger, nutrition interventions to every single resident of the 16 local government areas of Kwara State.
So ultimately, what we need is that we need healthier Kwaras. And one of those ways of getting healthy is to be sure that we eat good quality food, where we will also derive appropriate nutrients to be able to support living, to be able to support our intellectual development and so on. So I like to see more of this happen through ANRIN, and I like to see those impacts getting reflected in the life of our children.
Additionally, the lessons we've learned, the technical expertise we've built through the support of ANRIN will continue to help us implement not only the MSPAN, but other programs of the Ministry of Health and Kwara State government towards improving nutrition standards in Kwara State.
So we hope that we're able to transit from having a state with high burden of malnutrition to one where children are well nourished, our girls are well nourished, and we could have a better future and a better tomorrow for our children, for our state, and indeed for our country.
You know, looking at the children, they say they're the leaders of tomorrow, but how prepared are they for tomorrow? So we really have to pay attention to it, the nutritional status of these children, so that we can really have a population that speaks to the economy of the country.
The outcomes I would like to see essentially are a Kwara State where every child born has the advantage of a balanced diet at every meal on every day. Because we know that while children are growing, they need essential nutrients for the brain to develop to the maximum, to the optimum capacity. We want to see a Kwara where children are born and are fed well. 0 to 6 months exclusively breastfed, minimal to no nutrition-based diseases and illnesses, so that these children can fulfill their potential academically and physically as they go through life. This will improve not only the morbidity and mortality statistics that we are experiencing among children in Kwara State, but it will also improve productivity when they become adults, which ultimately, again, feeds into a positive loop for Kwara State.
Muna gode ma gwamnati da ya kama na wannan magani ga yaran mu lahiya lau, ga iyalin mu kuma sun haifa a lahiya lau. Muna gode ma Solina Aid wanda ya kawo mana wannan taimako da mutanen da suka zo kuma suka yi mana, mun gode masu. Maganin da suka kawo mana kuma ba mun saya da kuɗi mu ba, inda ba mu san ma inda za mu samu irin wannan magani, amma sun kawo mana kyauta mun ba iyalin mu kuma alhamdulillah muna gode masu.
Ẹ ṣé gan, a dúpẹ́ f'Ọlọ́run o, a sì dúpẹ́ lọ́wọ́ ẹ̀yin náà tẹ́ ń fún wa ní oògùn ní táìmù ìgbà tó yẹ kẹ́ fún wa. Tá a dẹ̀ ń lò fáwọn ọmọ wa tó dẹ̀ ń ṣiṣẹ́ tó ń bá wọn lára mu. Ọwọ́ yín máa ròkè o. Torí fún pé kí ni táìmù ìgbà tó yẹ kẹ́ fún wa lóògùn yẹn, ó ń ṣiṣẹ́ fún wa lásìkò ìgbà tẹ́ ń fún wa. A lọ sí hospital láti lọ mọ tán, láti lọ mọ tò pé ká lọ mọ ra oògùn, ká lọ mọ fi owó wara oògùn. Ẹ ṣé gan, a dúpẹ́, ọwọ́ yín ò mọ lòkè, iléeṣẹ́ yín ò ní jóná o.
Nigeria at large. the World Bank, Solina Health, Kwara State Ministry of Health, and all our donors out there.